Today we will discuss about myopia. Myopia is also known as short-sightedness. When parallel rays of light passing from infinity are focused in front of retina, this is our retina, they are focused in front of retina with accommodation at rest. Accommodation. What is meant by accommodation? Accommodation is nothing but when we want to see an object but we cannot see, we try to see that object. Like when we try to see a faraway object or near object, but because of blurring of vision, we cannot see that object. We try to see that object. That trying is known as accommodation. Our eye tries to accommodate that image by adjusting our refractive index accordingly. That is known as accommodation. It's a unique mechanism. Even we can even focus the diverging rays coming from a near object on the retina a bit to see clearly. This mechanism is known as accommodation. So at accommodation at rest, if the light rays converge in front of retina or focus in front of retina, it is known as myopia. Etiology. So what are the reasons for myopia to occur? Axial myopia. It results from increase in anterior-posterior length of eyeball. If this is eyeball, the length between cornea and retina or the optic disc, the last layer, this diameter is known as anterior-posterior length. If increase in anterior-posterior length of eyeball, it causes axial myopia. And the second etiology is curvatural myopia. Curvatural myopia. It is due to increased curvature. Increased curvature like this. If it is like this, instead of, if normal curvature of cornea should be like this, and increase in curvature of cornea or lens or both of them, it causes curvatural myopia, increase in curvature of cornea, lens or both. And the third etiology is positional myopia. It is due to abnormal position of lens. It was supposed to stay like this, but because of anterior positioning of lens, it causes myopia. And the fourth one is index myopia. Index myopia is due to increase in refractive index of lens, which is due to nuclear sclerosis, which is a age-related change seen in lens, increase in refractive index of lens. And the fifth cause is myopia due to excessive accommodation occurs in patients with spasm of accommodation. Myopia due to excessive accommodation. Excessive accommodation which is seen in patients with spasm of accommodation. Grading of myopia. The grading of myopia is defined by 3 grades. They are low myopia, moderate myopia, and high myopia. Low myopia, we tell low myopia if it is less than 3 diopters, and moderate myopia when it is between 3 and 6 diopters, and if it's More than 6 diopters, we tell it as high myopia. Clinical varieties of myopia. If it's less than 3, if it's between 3 to 6 diopters, if it's more than 6. Clinical classification. Varieties of myopia based on clinical classification. Congenital myopia, simple or developmental myopia, and pathological or degenerative. And the fourth one is secondary myopia. Congenital myopia, as the name indicates, it is present since birth. It is diagnosed at the age of 2 to 3 years. But in this case, they will react sluggishly. On fundus examination, myopic crescent is seen. And magnitude and progression of simple myopia. Usually, after the diagnosis, the patient does not exceed -6 diopters, but we all know that the progression can be seen every year. That's why regular eye checkups are needed to diagnose how much the progression occurred. Exophoria may occur in some patients due to imbalance between accommodative efforts and convergence. Diagnosis can be confirmed by performing clinical refraction. So, let us discuss what is clinical refraction.